What is fibromuscular dysplasia and renal artery stenosis? Have you ever wondered how certain conditions can impact blood flow and blood pressure? Today, we will discuss fibromuscular dysplasia and renal artery stenosis, two related issues that can significantly affect kidney health and hypertension management. Fibromuscular dysplasia is a condition where the walls of medium-sized arteries grow abnormally. This growth can cause the arteries to narrow, bulge, or even take on a beaded appearance. Unlike other vascular diseases, fibromuscular dysplasia is not due to inflammation or plaque buildup. It most often affects arteries that supply blood to the kidneys and brain, but can also involve arteries in the abdomen, arms, legs, and heart. Renal artery stenosis is the term used for the narrowing of one or both arteries that supply blood to the kidneys. When this narrowing occurs, it can lead to reduced blood flow to the kidneys. This reduction can cause a range of problems, including high blood pressure, also known as hypertension. In managing hypertension, especially in individuals with kidney disease, renal artery stenosis is a significant concern because it can be a treatable cause of secondary hypertension. Fibromuscular dysplasia is a leading cause of renal artery stenosis, particularly in younger women. When fibromuscular dysplasia affects the renal arteries, it can lead to hypertension that is often hard to control with standard medications. This happens because the kidneys respond to reduced blood flow by releasing hormones that raise blood pressure. If left untreated, this can further damage the kidneys and increase the risk of cardiovascular issues. Symptoms of renal artery stenosis due to fibromuscular dysplasia can include high blood pressure, abnormal kidney function, flank pain, and sometimes a whooshing sound heard over the abdomen with a stethoscope. However, many individuals with fibromuscular dysplasia may not notice any symptoms until complications arise. From a hypertension management perspective, recognizing fibromuscular dysplasia as a cause of renal artery stenosis is essential. Treatments for hypertension caused by fibromuscular dysplasia may differ from those for other causes. For instance, procedures like angioplasty can sometimes widen the narrowed artery, restoring normal blood flow and improving blood pressure control. Early diagnosis and appropriate treatment can help prevent long-term kidney damage and reduce the risk of stroke or other vascular events. Screening for fibromuscular dysplasia in patients with unexplained or difficult-to-control hypertension, especially in younger women, is a practical approach. Specialized imaging or procedures may be considered when necessary. In summary, fibromuscular dysplasia is a vascular condition that can lead to renal artery stenosis and hypertension. Identifying fibromuscular dysplasia as a cause of renal artery stenosis allows for targeted treatments that can improve outcomes and protect kidney health.